Good afternoon to all and namaskaram to all. A very warm welcome to the 26th Parva of Prabodhini webinar series. I, Dr. Preeti Sahu, welcome you all to this episode because we have recently completed our Silver Jubilee celebrations. We are really happy to see you all here again, supporting us and ready to grasp a lot of knowledge from our guest speakers. Our guest speaker have also joined, T. Sakthi Kumar, Dr. T. Sakthi Kumar. Namaskaram, sir. So let us start our session with Dhanvantari Vandana.
नमामि धन्वन्तरिम् आदिदेवम् सुरासुरे वन्दित पादपद्मम् लोके जरारुकभयमृत्युनाशम् दादारमीशम् विविधौषधीनां धन्वन्तरिं रमानाथं सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारम् वन्दे पीयूषदायकम् सर्वे जना सुखिनो भवन्तु सर्वे सन्तु निरामया ॐ शान्ति शान्ति शान्तिः
Om Dhanvantare Namaha. So with all the blessings of Lord Dhanvantari, we, the whole team of Prabodhini, welcome you all to Parva 26 of Prabodhini webinar series. Before starting the scientific session, let us just revise the rules and regulations of Prabodhini, and I will tell you something about Prabodhini. Well, you all know, you all are with us since 2 years. We are traveling this journey, and Prabodhini webinar series is organized by Shri Babu Singh Ayurvedic PG Medical College and Hospital, Farokhabad, UP. We all know that Ayurveda is the gift of our ancient sages. It is the treasure that we need to hunt and we need to extract everything out of it. It is written in the form of codes, it is written in the form of shlokas, which we all need to understand. So we need a guide, we need a teacher to teach us and explain the real hidden secret of all these things. So it is our effort, the whole team of Prabodhini with our Shri Babu Singh Ayurvedic PG Medical College, whole faculty, whole team is continuously doing their effort, giving their effort to collect gems from different parts of India, different parts of world who are practicing in the practical field with Ayurveda practice, and we are doing the effort that they should share their knowledge with you all. So our patrons are Dr. Shailendra Yadav sir, who is chairman of JS Group, Dr. Sunita Yadav man, chairperson, director of JS Group, and our beloved principal, Dr. Manjunath NS sir, principal of Sri Babu Singh Ayurvedic PG Medical College and Hospital, Farokhabad. The organizers of this Prabodhini webinar series include Dr. Niharanjan Mahanta, Associate Professor from Panchakarma Department, Dr. Preeti Sahu, of course, me, Associate Professor from Chaturvidha Department, Shri University, and Dr. Sheenas B.S., Assistant Professor from Panchakarma Department, Sri Babu Singh Ayurvedic Medical College and Hospital. So with us today, we have the whole team of Rachna Sharir and Sharang Pani sir, Gagan ma'am, and also Krishna sir are with us for today's episode. And since 25th April 2023, we have conducted 25 episodes till now, and many speakers, many knowledgeable persons have shared their knowledge in this journey. They have shared everything what they have with them. And in future also, we will try to bring more and more people who are ready to share everything. And today we have Dr. T. Sakthi Kumar with us. He will be explaining on unearthing the Chaturvidha Srotodusti for you. So we will try to extract the maximum out of him, and I hope sir is also ready and very excited to share everything with us. Just revising a little rules and regulations with you. Registration is mandatory. Registration is done through filling the Zoom forms provided in the link. After filling in the Zoom forms, you have to join the WhatsApp group Prabodhini through the link provided, as all the further proceedings will be intimated in the day. So, e-certificates will be provided to all the participants who are attending the webinar more than 45 minutes. So, attendance is compulsory. Please try to attend the initial 45 minutes. It is very essential, and it is the time, it is the maximum, take out the maximum output out of it. So you will get your certificates through email ID registered with us within 7 working days, and there is no need to share your email IDs during the webinar sessions. Please enjoy this session. Please try to grasp everything out of our guest speakers. You can also interact with our guest speakers. You can put up questions, your doubts, which will be cleared by our guest speakers. So, with this, my presentation is over. Now, I will invite our professor and HOD from Sari Rachana Department, Dr. Sharang Pani sir, to introduce our guest speaker for the scientific session.
Thank you, Dr. Preeti. I am Dr. Sarang Pani, Professor and HOD of Rachana Shari Department in Sri Babu Singh Ayurvedic Medical College and Hospital, Farrukhabad. It is immense pleasure to be introduced Dr. T. Sakthi Kumar, who is Assistant Professor in Government Ayurvedic Medical College, Nagercoil of Tamil Nadu. First of all, he started his graduation from Sri Jayendra Saraswati Ayurvedic Medical College in Chennai. After that, he went to become an expertise in Ayurvedic knowledge in treatment. He went to Ayurveda Arya Vaidyashala, Coimbatore. There he gained so much significant practical and clinical exposure. After that, he went to post-graduation to SDM Udupi, Sri Dharmasthala Manjunadeshwara Ayurvedic Medical College, Udupi. And I think he is the first person in Tamil Nadu who has completed post-graduation from the Rachana Shari department. After that, his academic career starts from 2012 in Dharma Ayurvedic Medical College, Shri Perumbudur in Tamil Nadu, where I was HOD at that time. And after that, he has joined the Government Ayurvedic Medical College as assistant professor. Still, he is continuing as assistant professor in the same college, that is the Government Ayurvedic Medical College, Nagercoil, Tamil Nadu. And he has so much knowledge in marma therapy and the pulse diagnosis, matlab jaise Nadi Vignan and the Marmu Chikitsa. He knows very well, he has trained very well, and he has given treatment to so many persons, holistically also. He has classified, he has especially focused on the diseases that like Karmaya, Daiva, Vyapa, Chikitsa, and he has done management and treatment by the traditional and the modern channels. And he is multidisciplinary personality. He knows very well regarding the Siddha medicine, which is the one of the best medicine in Marmu Chikitsa. And as a teacher, he has done mentorship to the students. He has guided so many students to become expertise in the treatment of Ayurveda. And he has done, he is author of several articles and research papers and journal publications. And he is the member of the NCISM, and he has visited so many colleges as NCISM member and the QCI member. And he has given so much services to the society by conducting so many free medical camps in the public and the tribal areas of Tamil Nadu. He has played an important role in disaster management like major natural calamities, like some tufans, especially the disasters which are mostly occurs in Tamil Nadu as Gaja cyclone and the Kozhikode flood and the Nagapattanam cyclone and the Satankulam flood. He has done his services in these flood affected areas, and he has given more services to the people, those who are very needy on that time. And he is also given treatment to nearly 1,500 people who is suffering with the COVID with Ayurvedic medicine only. And he is a best and good teacher in Rachana Sharif. I think Dr. Shakti knows me very well.
Yes, sir.
Now I hand over to Dr. Sakthi Kumar. Sir, please continue.
Namaste. A very good afternoon to one and all. Om Shri Gurubhyo Namaha. So before commencing the session, I would like to say my sincere thanks to Dr. Manjunath sir, the most respected principal, as well as the organizers, Dr. Preeti madam and Dr. Sharangapani sir. Dr. Sharangapani sir, I have seen you in Dharma Ayurveda College so many times. The most familiar personality in Dharma Ayurveda College.
I was the HOD on that time when you are joined as a lecturer there.
Yes, sir. Yes, sir. Yes, sir. I'm so happy to see you after a long time in this special occasion.
Thank you.
And thanks for all the organizers for providing such wonderful opportunity. And let me start the session. My topic is about on rather than it's a anatomy or anatomical seminar, it is a conglomeration of Kriya Sharir, Rachana Sharir as well as Roga Nidanam. That is what I can say. Because myself and Principal Sir, when we were discussing, Principal Sir was he was insisting me to talk about clinical aspects of Ayurveda and Rachana Sharir. So I had included lot of points from Kriya Shariram as well as Roga Nidanam as well as from Rachana Sharir. So my topic is unearthing the Chaturvidha Srotodusti, that is Cvsd, a sacred lens into the hidden currents of disease, alchemy of healing, and eternal vigil of well-being. Next slide. So before enter into the presentation, I would like to give you a small introduction. See, so here, as far as the Chaturvidha Srotodusti is concerned, you might have know about almost all the students will be knowing about the Chaturvidha Srotodusti. Chaturvidha Srotodusti, that is Atipravritti Sangova Sirana Grandayor Apiva Vimargado Va Gamanam Srodasam Dusti Lakshanam. We know these are the Chaturvidha Srotodusti. So actually, to dig out the Srotodusti, that is, to unearth the Srotodusti, we need to understand multiple factors. So if you want to judge the Srotodusti of a specific Srotas, we need to understand so many factors. That is nothing but Dosham, Dushyam, as well as Marga, as well as Margam, and so many factors. That is what we are going to see in the next slide. So for that purpose, we have included almost all the factors. We are not going to deal about only Srotodusti. We are going to see so many factors. Next slide. So here, that is what to understand the Chaturvidha Srotodusti, we need multiple factors. So the best thing to understand, suppose a patient comes and sits in front of you. Usually we will interrogate with the patient. We will get lot of information from him. If still we have any queries, we will go for lab investigation. And then when we go for lab investigation, as soon as we get the medical reports, that we will consider that as a prime cause. That maybe we will consider as a primary nidanam if the cholesterol level is more, if the calcium supplement is less, if vitamin D is more, or some other SGOT, SGPT level is more or less, we will conclude as that as a primary cause, and we will go for the what to say prescription. Is it the real way of completing the prescription? Whether the samprapti is complete over here? No, never. So to complete the samprapti, to understand the proper what to say diagnosis, to reach the proper diagnosis, to render a effective treatment, we need to understand the Srotodusti along with the dhatus and the Srotas, which Srotas got affected and which dhatu the Srotas resides in, as well as which dosha is the one culprit over here, and the Roga Marga as well as the prime Nidana. When all together come, then only we will consider it as a complete samprapti. Complete samprapti. Okay. So to understand that, we need to include, other than the modern investigation methodology, we need to include few more factors also. That is, we need to have some collateral routes. We need to have some alternative routes. That is what I would like to discuss here. I just want to throw few points regarding that. What are the alternative routes we need to, as a physician, as an Ayurvedic physician, we need to understand. Next slide. Next slide, please. Yes. So can I just minimize the slide because it's not fully visible? Just as because I couldn't able to see the full slide. So is the clinical probing the core nidana? That is, what all the factors we need to understand before entering into the proper samprapti. So first and foremost thing is physics, because till now we have not touched the part called physics. Physics plays a major role to understand the very basic principles or the Ayurvedic Siddhantas. In so many places, the physics can beautifully elaborately explain the Ayurvedic basic Siddhanta, because the one line basic formula behind Ayurveda and physics is both are Shashvatam Nityam. Ayurvedam, Shashvatam Nityam, as well as physics is also Nityam. The core principles of the physics are never ever can be changed. It is Nityam, so it can be. So here and there, I have included few formulas of the physics in these slides. How to incorporate in the what to say Ayurvedic protocol, as well as the next one is astrology. Astrology, most of the times it's very difficult to understand the concepts of astrology, but as an Ayurvedic doctor, we must understand the basic ideology of at least what is what about the astrology. That is very, very important. In most of the places wherever we feel our doshyas and the samprapti never gives the answer, never yield the result, there and all the astrology will give the results. So it is the duty of the physician to understand at least to know the very basics of astrological concepts. And the third one is nothing but the marma. So people think that, and most of the Ayurvedic community, unfortunately, we think that Ayurvedic concepts, to marma concepts are related to abhigadam or external injuries. Most of the times we feel that marma means external injury. Unless or until if somebody is getting hit from the external weapons or something else, we need not bother about the marma abhigadam. It is not so. This entire concepts of marma is something else. This can be explained beautifully under the Trividha Roga Margam. Beautifully explained under the Trividha Roga Margam in terms of, in case of chronic disease also. In chronic disease also, we can incorporate the concepts of marma. That is very, very important. Then the last one is Siddha. That is one among the mainstream of Ayush, as you all know very well. So why I have incorporated the Siddha system, being I am from Tamil Nadu, I know the values of Siddha, that is also around more than 2500 years old. And moreover, the basic concepts of Siddha, if you go through, that is also having the Panchamahabhuta theory, that is also having the Tridosha theory, that is also having the Trimala theory, and that is having lot and lot of life-saving measures, medicines, and they are in Siddha system of medicine. There are lot and lot of marma manipulations is been explained, which is absolutely missing in Ayurveda, what I felt. So the thing is, the most important thing is If a physician can incorporate the Siddha system of medicines in their clinical practice, it will be very, very useful. It is very, very useful because we can easily understand than anyone, than naturopaths, than what to say, Unani people. Being an Ayurvedic doctor, you can understand, we can understand the Siddha concepts. We can incorporate lot and lot of Siddha medicines as well. So that will be useful. Even lot and lot of diseases and its nidana, which is beautifully explained in Siddha system, that may help us for the proper diagnosis. So that is why I had included the Siddha system of medicine also. So move to the next one. The next slide is nothing but Karya Karana Siddhanta, as you all know very well. You all know very well. So we understood these are the few factors which can be included in the clinical practice for the proper diagnosis, for the effective treatment. But to implement these many factors, what is the baseline? What is the basic things which we need is nothing but Karya Karana Siddhanta. We must understand, we must have, we must be habituated to each and everything. We should ask the patient, whatever the patient says, whatever the allopathic, investigation says, we should not blindly follow. Immediately, the next thing we asked is how it has happened, why it has happened. That is what the student should develop since from the beginning. As a student, what we have to do is, and what you have to do is, since from the beginning, you should have the capacity and capability. You should be habituated to ask each and everything about the patients. Okay. So for that, what we have to do is, I would like to share here. I'm not going to talk about any, concepts or any slokas. I'm not going to discuss here. I would like to share few simple clinical cases. Simple, very simple 10 to 12 clinical cases. But it will be of that way of perception, the angle, the dimension we perceive is something different. That is why I would like to project here. That is multifaceted clinical relevance. That is what the next slide. So here what we are going to do here is, so kindly the students can carefully listen to the case. So each and every day, soon after your course, soon after your completion of the BAMS, as soon as you goes and sits in front, in your clinic, when the patient sits in front of you, you will face thousands of patients, such kind of patients. You have to interrogate, you have to find the solution within 5 to 10 minutes. So that is why I would like to share few of my experience, where we need the importance of Rachana Sharir, importance of Kriya Sharir and Roganidan, as well as lot and lot of yuktis. So the first case which I'd like to share here is a boy, the age is around 12 years old, 12 years old boy who came to our clinic. He is having the symptoms of more fatigue, that is more tiredness, general weakness, as well as loss of appetite, chronic constipation, as well as lack of concentration, loss of memory, and he is not interested towards anything. He is always lethargic. He is always having the tendency to sleep. This was the case actually. That is why I have mentioned. So here what we have to do is, as soon as the case came, we started interrogating in so many ways, whether they had any family issues, whether the particular student is having, the particular boy is having any other health issues, whether he has undergone any serious type of health issues, whether any other major health, with the help of lab investigations. We have gone through various investigations, but everything was perfect. Then after a long investigation, we understood that the boy is around, some 4th or 5th standard, and whenever he goes to school, he will carry the bag around 6 to 8 kgs. The weight is around 6 to 8 kgs of bag. That is very important. The nidanam is very, very simple and minute, but the effect is something different. Okay, that is why I would like to highlight here. So the thing is, the boy was carrying the school bag, which is around 6 to 8 kgs daily to his school, almost 3 to 4 years. And we know the, what to say, modality of the school bag. The school bag always, the kids used to carry both the belt. They will be wearing on the front of the chest. They will be wearing the front of the chest. What will happen here is, when we are wearing the belt in front of the chest, that is in the thoracic region, when we are wearing the belt in the thoracic region, it will create a sort of pressure. It will arrest the thoracic movements, because we know very well the thoracic cage has the capacity or capability to expand and contract, to expand and contract. So what will happen for the proper inspiration and expiration? So whenever the breathing process happen, with the help of these intercostal muscles as well as the thoracic cartilage, what will happen? The thorax will have the capacity to expand and contract. Because of wearing the belt, and the bag is around 6 to 8 kgs, what will happen? It creates a lot of tension or the stress in the thoracic cavity, that too in the front of the thoracic cage. So that what will happen, this in modern terms we will call it as TLC, that is called thoracic load carriage. That is called TLC, thoracic load carriage. What will happen here is, the amount of inspired air and the expired air will be very less. The amount of inspired O2 and the expired CO2 will be very less, because of the heavy weight, and the tidal volume will go very less. Oxygen depletion will be there. Okay, and there will be a severe stress in the cardiovascular system because of the prolonged usage of the bag. And because of the what to say, oxygen depletion, there will be a severe tiredness among all the systems. That is called dhatu that is called dhatu. And because of the stress and strain, there will be a severe vada prakopam all over the body, especially the Srotas which is affected here is pranavaha Srotodusti. Pranavaha Srotodusti. And because of the compression can be compared with sangam. Compression can be compared with sangam. And because of the sangam, the vayu or the O2 may not able to spread to the rest of the body. And even the O2 level is very less. And because of that, the patient, what to say, the general health of the patient has gone down drastically. And we gave the appropriate treatment, and gradually he came back to the normal life. And the most important thing, what we need to do here is, we have to make some life correction measures. That is, what we have to do is, in olden days, we might have seen all the people used to carry the bags on one side of the shoulder. They don't put the belt on both the sides, which will compress the thoracic cage. Got it? So this is the first case. And when we go to the next case, next slide, please. This is the second case which we practically seen in all the OPDs. This is most of the time we face lot of orthopedic issues in Ayurveda hospitals. And when we sit in front of the patient says, I have some severe pain in the right knee joint as well as in the right ankle. Okay, most of the time the patient aged above 40 years, 45 years, 50 years and all, when the patient come and tell, he says that what to say, I have severe pain in the left knee joint, sorry, my right knee joint as well as in the right ankle joint. When he says so, we will go for some, what to say, bone density test, and we will go for that, what to say, whether the calcium components are correct or not. We will give some calcium supplements as well as we will give some vadahara dravyas. But when a student asks us, okay, fine, if the calcium supplement is less, what is the problem? Why the problem has happened only on the right leg? Why not it happened on the left leg? So here lies the importance of the Rachana Sharir and the lifestyle disorders. So the most important thing, why not happened on the left side? Why it has happened on the right side? If the calcium supplement has gone down, it should reflect in both the knees. It should reflect in both the ankles. But it is happened only in one knee joint, that is on the right side. So when we keep on interrogating the patient, we will come to know most of the patients, if suppose, for an example, I am telling this, if the patient will tell he belongs to some medical representative, he is a medical representative, he used to travel a lot, minimum of 80 to 100 kilometers per day with the help of two-wheeler, which is of Kickstarter. That is very important, which is of Kickstarter, not the self-starter. So if a patient continuously using it for continuously kicking the bike for minimum 5 to 10 years, that too per day 5 to 10 times, the violent stretch, or the violent movement or the violent force which is exerted in the knee joint as well as in the ankle joint will create lot of friction in the knees. This creates lot and lot of rukshada among the sandhi and the snayus. And because of this, the Shleshmaka kapha will dry off. The Shleshmaka kapha will dry off. And at last, the Sandhi Muktam takes place. That is nothing but degeneration takes place. The synovial fluid will totally dry off. Because of that, the Astivah Srotas will badly affected. And the violent stretch or the violent force continuously exerted by the patient is nothing but Atipravritti. The force which is exerted in excess than the normal. And because of the excess Atipravritti, after some time, the Sangam will happen. Because of the excess friction, there is no synovial fluid. At last, there is a dryness. Because of the dryness, the blood circulation will get hampered, as well as there will be a friction. What to say? It may lead to uneasy movement of the knee joint. Okay. So this is the second case. And the next one, next case. Next page. Yes, this is the third case. So when the patient nowadays, this is also a quite common thing. Most of the students, most of the people who travels more, they are getting a disease called facial palsy. In Ayurveda, we will call it as ardhidam. We will call it as ardhidam. Ardhidam. And we know very well the modern pathology of the ardhidam. In Ayurveda, we can call it as Siradamani Sankocham of the Mukham. How it is happening? That is, ardhidam is nothing but deviation of the oral cavity as well as the facial muscles towards one side. Okay, along with the nose, sometimes it may affect the eyes also, a part of eyes. So that is called ardhidam. And of course, one more disease also I would like to add here, that is called a DNS, that is deviated nasal septum. The nasal septum, that is nothing but the nasal cartilage which is seen inside the nose, which divides the nasal cavity into two. Okay, that is made up of cartilage, that is called nasal cartilage, will have a bend towards one side, either left side or right side. We will call it as DNS. That is also quite common. These two diseases nowadays we are repeatedly coming across through. The reason behind is nothing but the simple issue, excess exposure to the wind, that is Vada Atapa Sevanam, excess exposure to the Vata. How it is happening nowadays? AC is the common factor which we are seeing everywhere. It is almost in the classroom sometimes, even in sometimes in the office, sometimes in the home, sometimes in the clinic, wherever you go, you can find AC or air cooler, or sometimes what to say, fans. So constantly without fan, we cannot imagine a day. So without fan, we cannot imagine a day. How come this may leads to the facial palsy? If the patient sits in front of AC, we can see the deviation. We can see the deviation of the patient. By seeing the deviation, we can understand, we can ask the patient which side the AC belongs to and the patient was sitting on which side. We can easily understand, because when the patient sits below the AC or air cooler, and when he is constantly exposed to the chilled air or the fan for the matter of some around 6 or 8 hours continuously, this may happens with the driver also. This may happens with the driver, those who are driving for longer duration, taxi drivers. For the comfort of the customers, they will keep more AC and they will sit in front of AC. They will travel for longer duration. So the AC will come and hit on the driver's face continuously for 8 hours, 10 hours and all. Because of the constant exposure to the excess vadam, that may leads to vada adhika ruksham. Because of the rukshada, the sira damani sankojam will takes place. Because of the rukshada, the snigdam which is seen in the sira damani will dry off. It may leads to sankocha. This may leads to facial palsy. Facial palsy is fine. What about the DNS, the cartilage which is seen inside the nasal cavity? That is also quite common. So we all forget one thing. The nasal cartilage is nothing but a sort of asti as per Ayurveda. That is called tarunasti. Rachana Sharif strictly says that that is a part of Asti called Tarunasti, nasal cartilage. Cartilage, all the cartilage comes under the Tarunasti. So when it comes under the Asti Visheshatva dosha is nothing but Vada dosha. In Asti, which dosha is there? According to Ashray Bhavam, Vata dosha. So when we keep the AC in front of us, automatically the air which you are inhaling, that is very chilled air, will enter inside, that will hit the nasal cartilage, that will create a sort of rukshada. Because of the rukshada, there will be asti vakrada. Asti vakrada. As like in rheumatoid arthritis, chronic cases of rheumatoid arthritis, we can find the bending of the bones in the extreme stages of the rheumatoid arthritis. The same thing is happening inside the nose also. So we should treat the DNS as the Vada Vyadhi. We should treat the DNS as Vada Vyadhi. We should apply some oil inside the nasal cavity. And we can give some strong Vadahara Tailas inside the nasal cavity, so that in due course of time it will come back to normal. Okay. And moreover, the students who are residing in hostel, they will switch on the fan. They will straight away sleeping below the fan. The whole night, the nasal cavity will be exposed to strong wind. If they exposed to such kind of atmosphere for 6 months, 1 year and all, it may lead to DNS. Okay. So here okay. So the next slide. Let us go to the next case. So the next case where the patient complains of Vishamartavam, Kashtartavam, the lady patient aged around 35 to 40 years old complains of Kashtartavam or Vishamartavam, that is irregular periods. She may get the periods for 1 month and the next month she won't get. And sometimes if at all the periods or menstrual cycle comes, she may be having the excess bleeding with pain, with clots, as well as with white discharge, with severe low back pain. These are the primary symptoms. When we go for long interrogation, we came to know everything was perfect. Her food style is okay. Her lifestyle is okay, other than one and only factor. What we understood is nothing but she was using the high heels for longer duration. High heels, as because we all know very well, high heels nowadays, it's become a fashion among the ladies, those who are very short. So to show them as a tall one, they will use the high heels. Because of usage of the high heels, what will happen? There will be a elevation of the calcaneal bone. That is the first point. And the point number 2, because of the elevation or upliftment of the calcaneal bone, there will be a contraction of the Achilles tendon. That is seen, that lies above the calcaneal bone. And because of the contraction of the Achilles tendon, there will be a contraction of the calf muscle which lies above the Achilles tendon. And because of the contraction of the calf muscle, in turn, it will have the effect on the posterior compartment muscles of the thigh. It will create a sort of pressure. And because of that pressure, it will create a sort of, unwanted pressure on the gluteal region. So this is a chain reaction. Anatomically, you can beautifully explain in the slide. So this is a sort of chain reaction. This is a clear anatomical link. It starts from the calcaneum, then tendon, then calf muscles, then posterior compartment of the thigh. Then ultimately it will end up with the gluteal region. In the gluteal region, we have the pelvic cavity, a cup-shaped bone. And inside the pelvic cavity, we have got lot of most vital structures, that is uterus, as well as urinary bladder. And there will be because of this excess pressure, there will be a altered pelvic tilt. That is, the pelvic tilt will be there, or anterior pelvic inclination. The pelvic bone will be inclined anteriorly. Instead of, it should be like in the normal position. Instead of resting in this position, it will be tilted anteriorly. So what will happen? The structures which is seen inside this, that is bladder as well as the uterus, will get overloaded one over the other. Will get overloaded with one over the other. These may lead to lot of stress on the ligaments of the uterus which supports it. And in due course of time, if she is using the high heels continuously for years together, because of the unwanted pressure, the supports, the ligaments, the true ligaments of the uterus will become weak. And of course, there will be a altered hormonal secretions. And because of the altered hormonal secretions, there will be a Vishamarthavam, Kashtarthavam, Vada Prakopam, that is Apanavayu Prakopam, because of the Atipravritti and Vimarga Gamana. Vimarga Gamana, because the Nidhanam doesn't start from the pelvic cavity, it starts from somewhere else and end up with pelvic cavity. This is called Vimarga Gamana. This is called Vimarga Gamana in Srotodusti, we will say. So we should be very careful while handling such kind of cases. We should adopt the Rachana Sharir concepts. So the next slide. So the next one is, let us come to a bit of physics, because in introduction we told something about the physics and all. So it's our duty to explain something about the physics also. So when we talk about the thermoregulation, there are some interesting concepts which is explained in Chikitsa Sthanam. So nowadays people, we are getting the patients repeatedly on UTI, that is urinary tract infection. It may be male or female, lot of urinary tract infection. Infection in modern terms, it's simply some abnormality, that's it. But in Ayurveda, if a patient is having burning micturition, we will call it as infection. If a patient is having what we say painful micturition, that also we will call it as UTI. No, never. Ayurveda has got specifically Vata, Pitta, Kapha and various categorization of UTI. So how it is happening? Why nowadays so many people are getting recurrent UTI? So when we go through the concepts, when we start interrogating lot of patients, we came to know the patient doesn't have, male or female partner doesn't have any venereal diseases. If at all the male or female partner is having some infection, it may spread to the other partner. There is no such issue here. Point number one. And the second thing, usage of common toilet. People, most of the Ayurvedic community, we people always used to tell the patient that don't use common toilet, because of that you are getting UTI. That is, sometimes if the patient constantly doesn't use the common toilet also getting the UTI. So in such circumstances, I was interrogating with the patient, then we came to know some interesting concepts. The first one is most of the patient after dinner, that is after nighttime food, soon after the food, before the food gets digested properly, if they are indulging in sexual intercourse, what will happen? These sort of urinary tract infection may come. How is it possible? What is the link between the urinary tract infection, sexual intercourse and dinner? We must understand the most important concepts. The students can kindly note down the point. That is the most important and the interesting aspect. If two actions are happening simultaneously inside our system, if two important actions are simultaneously happening inside our system, the higher concentration or the superpower will try to supersede the less power or the weaker one. You must understand this. Okay, I will try to explain with the help of the second law of thermodynamics. I think these are some 5th, 6th standard physics. It's not a very big physics and all, but still I would like to explain here. According to the second law of thermodynamics, it says that heat will naturally flows from the higher temperature to the lower temperature. That is what we will call it as osmosis, etc. We will say. So basically the heat energy, which will be always having the tendency to spread from the higher concentration to the lower concentration. Why I have taken as heat is nothing but Jadaragni. The higher heat is nothing but the Jadaragni, and the lower heat or the less heat can be considered it as the Dhatvagni. And this less heat will be governed by the higher heat, that is nothing but Jadaragni. Without Jadaragni, there is no Dhatvagni, we know very well. And even in thermal equilibrium, when we talk about the thermal equilibrium also, two objects of different temperature, when they are come in contact with each other, the heat will try to flow from the hotter to the colder objects until they reach the same state. That is called thermal equilibrium. So this is what happening here. When the patient tried to have the sex, there is some loss of energy in the Shukra Srotas. Definitely there is some loss of energy, Dhatu Agni level, at the level of Dhatu Agni, at the level of Shukra Srotas, there is some energy loss. To compensate the loss, what will happen? The Jadaragni will try to share some essence, will try to share some, it tries to send some energy to the Dhatu Agni, that is nothing but Shukra Dhatu Agni, and as well as to the Shukra Srotas. But unfortunately, we are not giving the enough time for the Jadaragni to digest the essence, to digest the food properly. So in Haribari, what it will do, the Jadaragni sends the unbaked Amaja foods or unbaked foods or the semi-digested or half-digested foods. It will directly send to the Shukra Dhatu Agni. So as soon as the Shukra Dhatu Agni receives the Amam, it couldn't able to digest. So the Amam resides in the Shukra Dhatu Agni for some time. It will be converted into Ama Visham. In later stages, it will be converted as urinary tract infection. This is absolutely practical one we are facing in nowadays. And for a best example, one more example I would like to say here is the students, most of the students nowadays, it's quite common. They will be having the food simultaneously, they will be watching the mobile. So two simultaneous actions are happening. So the energy, there is an energy loss through the Chakshurvaha Srotas by watching the mobile. So the Jadragni will understood that there is some energy loss. It has to supply. So what it will do? So it sends some Amam, which is of undigested food, because we are not giving the enough time. So the undigested food particles, before it get digest only, it starts from the Jadragni, it ends up with the Chakshurvaha Srotas, and it will block the Chakshurvaha Srotas. So that is why nowadays almost all the school kids as well as the college kids are wearing the specs. They are suffering with short sight, long sight, etc. So this can be explained with the help of the thermoregulation. Next slide. Next slide. So the next one is, let us talk about few aspects about this importance of Manavaha Srotas. That is also very important. When we talk about the Manavaha Srotas, people almost in and around you, we can find such kind of cases, plenty of cases we can find. Those who are suffering with Manavaha Srotas, because stress, depression, bipolar disorders are quite common nowadays. The patient who came, the male patient who aged around some 40 years or 45 years, he is a male tailor who used to stitch the dress materials for the ladies, So most of the times, he used to measure all the way the length and breadth of the various measurements of the ladies from the ladies' bodies. So he used to touch the ladies. So what will happen? Because of the prolonged exposure to the ladies and lady customers, there will be a sexual arousal in his mind. There will be a sexual arousal. He couldn't able to control it, but still he has to control the such things. So in such thing, what will happen? The sexual arousal was 24/7. He will be having the sexual thoughts in his mind 24/7. When the patient comes and approaches, he will say that there is a lack of appetite. He doesn't have appetite at all. And second thing, he will easily get anger with everyone. That is the second thing. And the third thing, always he will be having the tiredness. That is the third thing. Severe body pain will be there. That is the fourth thing. And the most important factor which you can easily understand, that is, he will not have the eye contact personally with anyone. He will not have any eye contact with anyone. He will be having the upward gaze or the downward gaze. That is very important. So this is what Ayurveda explains called Kama Jwaram. This is called Kama Jwaram because of the Manavaha Srotodusti. Because of the Manavaha Srotodusti. If you touch the patient's body, you can able to feel the heat. We can able to feel the heat. That is called Kama Jwaram. Nowadays, we don't go for such kind of diagnosis most of the time. So when you became the doctor, the students became the doctor, you have to keep it in mind here. The Manavaha Srotodusti is there 24/7. He is thinking about the sexual thoughts. That is nothing but Atipravritti of the thought process. Because of the excess thought vibration, there will be a heat generation inside the body. Because of excess friction due to the mind waves, there will be a heat generation inside the body. So this is absolutely due to Manavaha Srotas, and the Srotodusti is nothing but because of the suppression. He is suppressing the sexual thoughts. A sort of amam will be seen inside the Manavaha Srotas. So don't think that amam is seen only in the physical body, but also in the subtlest aspect. That is, in the Manavaha Srotas also, we can find the amam. Okay. Let us go to the next slide. So I would like to quote an important and interesting aspect which is explained in Siddha system. There is a disease called Savalai boil or Savalai node. This is an interesting aspect. Once again, it talks about the Manavaha Srotodusti. So it talks about a boy who is around 2 to 3 years old. A boy who is around 2 to 3 years old. Once again, he is having lack of appetite. He has absolutely lost his weight. That is, the boy was around some 20 kg or 15 kgs, 15 to 20 kgs. Now he has reduced to some 12 kgs. Drastically, there is a drastic weight reduction, severe weight loss along with lack of appetite, loss of appetite, and he is totally in the depressive mood, and he don't mingle with anyone. He is not interested towards the sports activities also. Neither he is not mingling with the parents also. When we start interrogating the case, okay, these are like what to say. When you start trying to analyze the prime cause, it is like a CBI investigation, okay, crime branch investigation. When you try to interrogate with the patient, we will get lot and lot of new what to say information. So when we start interrogating the patient, that is patient's mother, we came to know that boy has got a new younger brother. The age gap between them is around just 2 years or 1.5 years or 2 years old. It's very small gap. So because of the what to say continuous what to say pregnancy, the mother may not able to concentrate on the elder son, and because of the sudden loss of the care from the mother as well as from the father, the boy will be totally in the confused state. Even though he is a small boy, he may not able to judge what is good, what is bad, but he can able to understand something is missing. That is nothing but the care from the mother as well as from the father. He was in totally in the what to say confused state, and he feels totally isolated, and he feels so much depressed. And when he is pushing to the condition that is devoid of breastfeeding, etc., because the mother has to feed the younger son, so she may not in a position to feed the younger son sometimes, so he will be totally deprived of what to say the absolute care from the mother and the father. So because of the continuous such kind of what to say prolonged what to say uncare or loss of care, the boy in the depressed mode, he will be like goes to the Kshayaja condition, almost like a Rajakshma. The patient or the boy will mimic the symptoms like a Rajakshma. Rajakshma is a sort of TB like, tuberculosis like. The patient will be very lean, he will be having less immunity, he will be always getting the jwaram on and off, such kind of things will happen. So this is beautifully explained in what to say, Roga Adhiharam of Agasthyar Vagadam of Siddha textbook. Let us move to the, here also the Manavaha Srotas is the major factor here. Let us move to the next slide. So the next one, a very important thing. We know very well about this Ahara Aushadha Sevana Kala. We know very well about the Aushadha Sevana Kala. There are 11 Aushadha Sevana Kala which is explained in the Ashtanga Sangraham. Aushadha Sevana Kala is nothing but the time of prescribing the medicines, time of giving the medicines to the patient. When we are giving the medicines to the patient at the appropriate time, the medicine will reach the particular target. Some medicines will act on the hridayam, some medicines will act on the basti. If you give the medicines in the morning time, it will act on the basti and the apana pradesham. If you give some medicines in the middle of the foot, that may act on the samana value. Okay, so such kind of things is being categorized. Whether is it only applicable for aushadis or it can be implemented for aharam also. Why can't we implement it for ahara? When we give some ahara in the particular time, this ahara will have effect on hridayam. When we give some ahara on the particular time, it will have effect on the shiras. We can do like that. So this is what I made a sort of modification, because I understood that there is a lot and lot of patients nowadays, they are getting tonsillitis, gingivitis, mouth ulcer, and most of the time they are getting DNS, sinusitis, rhinitis. These are very, very, very common nowadays. When we were keep on digging the unearthing the Srotodusti, we understood there is some problem continuously triggering the Urdhva Chatrus. Then we understood that the time of taking food nowadays, that is 2K kids nowadays, the people, the students, and as well as the younger generation, most of the people, they are taking the food during the heavy foods. That is Paryushidannam, Pichilannam, and Guru Snigdha Aharas, all the heavy foods. Usually in olden days, they won't take a single heavy foods during the night time because the digestion will be very poor. But nowadays, it's ultimately ulta. It's totally upside down. All the feast, all the major functions, all the dinner, major dinner, as well as the parties are happening on the night time. So we will be taking all the non-vegetarian foods, as well as the pichila aharam, as well as the sweets, as well as all the foodstuffs during the night time. When we take such kind of foods during the night time, Urdhva Jatru Vikareshu Nishi, that is called Aushadha Sevana Kala. It says that when we take the medicine during the night time, it will affect, it will have impact on the shiras. So instead of medicines, when we take such kinds of food during the night time, it will obviously the Dushita doshas, the Prakupita doshas will go and lodge over in the shiras region, and it will create the sinusitis, rhinitis, as well as the gingivitis, all sort of things will happen. So this is very, very important, incorporating the Aushadha Sevana Kala with this Ahara Sevana Kala. Okay. So let us move to the next one. Next slide, please. That is Shiro Roga Nidanam. The same thing which is relevant to the previous slide. And Netra Roga Nidanam. So here I would like to highlight one more concepts of physics. That's a very basic concept. So many patients nowadays are getting the problem with the eyes as well as the shiras. So what might be the reason? Because of the prolonged exposure to the, what to say, prolonged exposure to the cold. Okay, exposed to the AC, and suddenly we are exposed to the sunlight, or suddenly when after exposed to the sunlight, suddenly entering into the AC hall, or taking the cool drinks or refrigerated drinks. Okay, or what to say, taking cold water bath after exposure to the sunlight. So most of the time, the Ayurveda strictly says that the Vata along with the Pitta, the Vayu along with the Ushna, the what to say, the Ushna along with the Ruksha will mix it together. It will have the tendency to move up and it will enter into the Shiras. It will affect the Shiras region. It will affect the Siras, Nayu, Damani of the Shiras. The Shira, Damani and the Snayu of the Shiras, especially in the eyeball. So when we were doing our UG, when we were reading these slokas, we will be amazing. How come a Vayu along with the Pittam, when it mixed together, why not it happens? Why not it goes on the oblique direction, that is Tirya Gadi? Why not the Vayu should travel on the downward direction, that is Adogadi? So here lies the importance of the physics. Here lies the importance of the physics. So as per the thermal mechanism or the thermal energy, when the gaseous molecules gets heated, that is when the gas molecules gets heated, the molecules will expand. Because of the expansion of the molecules, it will become less dense, and when it becomes less dense, it will have the tendency to move up. It will have the tendency to move up. That is what I have picturized in the slide. Okay, so the same phenomena is happening inside our body also. The Vayu, the Panchavayu, which is seen inside the body, in the middle of the, what to say, 80% of the water component, when it gets heated up, when we expose to sunlight. As soon as we enter into the AC hall, because of these two exposure, Vadam along with Pittam, these both mixed together, it will move up and affect the Shiras, because it will, the Vata will become so light, the molecules will become so light, it will have the tendency to move up, it will affect the Shiras. Okay, So that is a very, very important thing. That is what happening with the pressure cooker also. When you heat the pressure cooker, the fumes, hot fumes will go up, not in the oblique direction. Okay, that is what happening here also. So the next slide. Next slide. So this is about the, let us, almost we have reached the last part. That is without, what to say, talking about the marma, the session will not be completed. That is why I had incorporated a part of marma. So as we all know very well, marma, the concept of marma, most of the time we, our Ayurvedic community, we Ayurvedic doctors strongly believe that marma vigada means only external injuries. It is no way related to the chronic diseases or prolonged illness. But Shushruta Sharirasthanam Marma Vibhaga Shariram, it clearly states at the end of the chapter, Shushruta clearly states that Marma Vigadam takes place due to, not only due to the external factor Avigadajam, but also due to the Dosha Prakopam. So prolonged illness, if the dosha stays inside the body for longer duration, it will follow a specific track. It will travel through the specific track. In the last stage, it will reach the destination called marma. That is what explained in terms of Trivida Roga Margam. Trivida Roga Margam, you all will be knowing very well. Koshta Shaka Sandhi Asti Marmaha. In Ashtangradema Sangraham, they had clearly explained that Koshta Shaka Sandhi Asti Marmaka. The doshas initially it will be residing in the Koshta. Gradually, it will start to spread towards the Shaka. At last, it will end up with this Sandhi Asti Marma. So this is the normal course of the doshas. The same phenomena is applicable for the abnormal doshas also, prakupita doshas also. So that is what happening here in terms of COVID. I am just giving a simple example because we had treated around more than 1,000 plus cases during the time of COVID. I am not just going in detail about the COVID. If you keenly observe the symptoms of COVID, in the initial stages of COVID, there will be some stomach related ailments, there will be a simple cough, there will be a simple fever, so that we can understand the doshas are residing in the koshta. And when the same COVID infection in later phases, when it starts occupying this other body pain, as well as severe, cold and cough, okay, that we can understand that the doshas has reached the shaka. And when it reaches the extreme stage, when the doshas has reached the extreme stage, when the casualties are more in the later phases of the COVID, you all will be knowing very well, lot of casualties. And we know very well the most important symptoms of COVID. There will be a severe lung infection, lung failure, as well as the cardiac failure, inflammatory changes in the cardiac vessels, and pleural effusion, and severe cough, severe cold that may leads to depletion or the drop down of the oxygen saturation that may leads to the death of the patient. This is the last phase of the COVID. So if you keenly observe these kind of thing, can be seen anywhere inside the Samhitas. If you see the first phase of thing, we can find the second phase, third phase, when the COVID infection become very severe, the three doshajam, that is Vada Pradhana Pitta Kapha, that is what the COVID combination of doshas. When the Vada Pradhana Pitta Kapha doshas started spreading into the marma, that too in the level of Pranavaha Srotas. Pranavaha Srotas, you know very well, in the chest region as well as in the Shiras region. So Pranavaha Sroto Moolam is Hridayam Mahasrotas. So Hridayam as well as Mahasrotas. So the entire thoracic cage cavity, we will put it under the, Srotas. So Pranavaha Srotas. When what has happened, when it enters inside, it will try to hit the Prakupita dosha, the Tridoshaja will go and hit the marmas called Sthana Moolam and Sthana Rohida marma. Sthana Moolam and Sthana Rohidam. You can find two marmas in the thoracic cage near the nipples, near the sthanam. That is nothing but Sthana Moolam and the Sthana Rohidam. If you see the Sthana Mula patient, what to say, sloka of the patient, Kapha Purna Koshtataya, Kasa Shwasa Abhyam Riyade. That is excellently explained in the Shushradam Sharira Sthanam. Kapha Purna Koshtataya. What is Kapha Purna Koshtataya? When the doshas went and lodges in the Sthana Mula Marma, it hits the Stanamula Marma. Immediately, the Stanamula Marma will secrete lot and lot of fluids. It will accumulate the entire thoracic case, that is in the pleural cavity. We will call it as pleural effusion. We will call it as pleural effusion. In olden days, they had called it as Kapha Purna Koshtataya, the kapham filled thoracic cavity. Kasa Shwasa Abhyam Riyade. Because of that, there will be a severe suffocation, dyspnea. Because of the Kasa Shwasam, the patient may die. And the second one is Stanarohidam. Stanarohidam is nothing but Lohida Purna Koshtataya. Lohidam is nothing but blood. That is called hematemesis. That is what happening in the severe cases. Hematomesis, hemothorax. That is nothing but hemothorax. So what has happened here is the blood-filled thoracic cage or the pleural cavity. So when it is filled with the blood, Shwasakasabhyam riyade. Because of the severe suffocation, kasa shwasam, the patient will die. So it is a clear-cut concept stating that even the doshas will attack the marma, it will create the marma abhigada lakshanas. Okay. So here from this we understood the importance of the Srotas. So the next one, last slide I hope. Next slide. So Ayurveda for all. So from this we can understand lot of things. Ayurveda is not what to say, clearly restricted to the human being, but also for everyone. If you can understand the dosha, dhatus, margas, ashayas, as well as nidana, we can treat any kind of cases. A patient with severe tiredness, a patient with rakta mutrada, that is bleeding, hematuria, that is urination with blood, and the doctors were telling the patient will not severe fever also, and the doctors were telling the patient will not survive anymore, he or she may die in within 2 or 3 days. And the patient came to us, we treated, we understood there is a problem with the raktavaha Srotodusti, and there is a Vimarga Gamanam also. What is Vimarga Gamanam? Because the blood is flowing through the other margam, that is through the urinary tract. So, and the dosha here is Pittam and Vadam. So, we treated Vada Pitta Jara. We treated the Raktavaha Srotas, and the patient was absolutely normal now. And the patient is very happy. I just want to show the patient. Can you show the next slide? So, this is the patient. This is actually a goat. We have treated around 15 days before. So if you can able to understand the Srotas, Srotodusti, Srotomargas, we can treat even the goats, dogs, whatever it may be. Whatever it may be. Here, there is no barrier at all. There is no barrier at all. Okay. So the next slide. So this is all the take home message coming to the end of the session. So I hope we have covered the various aspects. We have not gone through the single stream. We have gone through the various aspects. So I just want to conclude these. I just want to summarize these many points. Fundamental knowledge about every occupation is very, very important. Every occupation, as a doctor, as an Ayurvedic doctor, you should know about the working pattern of all the occupation and the rudimentary idea about the various accessories which provide the comforts like mobile, AC, shoes, bike, fridge when we are using such kind of accessories. So what are the pros and cons we must understand? What all the Srotas may get affected we must understand. Manasika doshas should be given equal weightage as like that of the Sharirika doshas. People think Manasika dosha means only depression, bipolar disorder. No, never. Even small things may lead to the Manasika vigaras. So the principles of Aushadha Sevana Kala can be adopted in Ahara Sevana Kala too. And the next point is Marma vitiation is not only seen in the external injuries but also in the Sharirika Dosha Prakopam. And the last one, other than the usage of the modern theories, incorporation of the physics, Siddha principles, etc. gives wider vision and clarity in understanding the Ayurvedic Siddhantas. I hope I have the shared few of my inputs, whatever I know, whatever I understood. Here, those who are having any suggestions, any clarifications, feel free to talk. And before concluding the session, I would like to say my sincere thanks to Dr. Manjunath sir for providing such a wonderful platform, and Dr. Sarangapani sir and Dr. Sheetal ma'am and each and everyone and all the students of the college and all the participants for your active participation. Thank you one and all.
Thank you, sir. Actually, we can, if anyone have any queries, you can ask in the chat box is there. A question answer session one box is there. You can put the questions in the question answer session tab. Sir, one question came from Perumal Swami. How to develop this type of thinking while consult the patient? I think that logic creation is thinking about that. That is a long process. Please give some answer, sir.
So the thing is most important, what is a skill which a Vaidya needs to develop is, that is what I have summarized in the last, what to say, I have summarized the last slide. So we should, as a Ayurveda is basically not a medical science, it's a life science. So we have to have the ideology about each and every occupation. We have to have some idea about the food and lifestyle of various state people, cultures of various people, as well as the climatic conditions of various people, as well as what to say, the working pattern. So we need to have everything. Then only it will, what to say, make our ideas, what to say, it will widen our ideas. Otherwise, what to say, with the help of this bookish knowledge, it's very difficult to practice Ayurveda as it is, because it has got n number of, what to say, new ideologies. When you are trying to incorporate the physics, when you are trying to incorporate, even you can incorporate the chemistry also. That is also, what to say, is a wise choice. So one thing you must understand, whatever the knowledge you have gone through till the date, okay, it may be from the first standard till today, BMS first year, second year, third year, whatever. So whatever the knowledge you gained, try to make a link with the Ayurveda and its concepts. Okay, in that way we can make a link, because medical science is going in one direction, life science is going one direction. This will not serve the purpose. And moreover, a physician must be a sadhaka. He must at least go through the meditation techniques at least daily, twice or thrice, at least for 5 minutes or 10 minutes, so that he will get the very good clarity about each and every case. He will get very good clarity. Only that much I can able to.
Okay, thank you so much, sir. So one more question is there, the treatment of hematuria secondary to CO of urinary tract system.
Yes. Can you repeat, sir?
Treatment of hematuria secondary to CA of cancer of urinary tract system.
Yes, sir.
Asking treatment.
Yes, sir. For secondary, for cancer. Sir, can you repeat once again? Treatment of hematuria.
Treatment of hematuria secondary to cancer of urinary tract system.
It is very difficult. Basically, cancer comes under the Yapyam or Asadhya Rogam. The two in the initial phase, we can do it. We can do it. In initial phase, we can go for Pravala Basmam, etc. Loka Purusha Samyavada, Pravala Basmam, etc. We can go. Hematuria, that can be considered it as the Adogada Rakta Piktam. Adogada Rakta Piktam associated with the, what to say, either Granthi or whatever. So we should treat rather than treating the disease, we should treat the avastha of the disease, whether it is a Sannibadam or Dvidoshajam, we should understand first. If it is purely located on the Mutravaha Srotas, try to give some medicines, try to give some Adogada Rakta Pikta medicines, which is having the effect on the CA also. So because I told you in the initial session, I am not going to discuss here about the medicines, because it may create further more confusion, because lot of first years and second year students are there. So we can do like that. The thing is, avastha is very, very important. Don't run behind the CA or whatever hematuria. We should conclude it as a, what to say, adogada rakta piktam associated with some tridoshaja sannipada vyadi or whatever. So we can give the medicines accordingly. That's it.
Okay, thank you, sir. Okay. So one more question came: how to fix dosage when it comes to treating animals?
Sir, once again, sir, please repeat.
How to fix a dosage when it comes to treating animals?
Yes, yes. That is what. It's very difficult to get the information as because I got the patient initially, what to say, most of the time, those who are, we cannot treat the pets which is roaming in the streets. It is very difficult because getting the information, what is happening inside the body, it's very difficult. Almost we have treated some 7 to 8 cases, some pets we have treated. But the thing is, the most important thing is most of the time we get the information from their owners, from the party owners. So here also the goat's owner, she was telling that since 2 days that goat is having so and so symptoms, and since 2 days usually it will not like that. So these are the symptoms exhibited by the goat because the owner is keep on watching the goat for the past 2 years. So they knows the things well. We should get the information from the owners and accordingly we can treat the patient. That's it.
Okay, thank you, sir. Actually, one more question came. Actually, that is a long question. So, in some cases, patient will tell that they would suffer severe headache if they were in AC room only. In normal condition, patient feels free. How can we assess this condition, and how can we see the Srotodusti here?
So it's very simple. It's very simple. Shita Vata Sevana, that is the Shita Gunam of the Vata is increased here. The Shita Gunam, the Vata has got Tatra Ruksho Lagu Shita Karaha Sukshma Shalo Anilaha. So as such, the patient might have the severe Rukshada is already existed in the Shiras in some of the Srotas. Okay, or else the patient might be what to say under severe stress. If the patient is under severe stress, either Vatam or Vada Pittam will be under Prakopam. That is the first choice. And the second choice, if it is of Vada Prakopam, as soon as he enters into the AC hall, because of excess Shita Gunam which is prevalent inside the AC hall, once again provoke the Vada Prakopam. These may leads to the Sankocham. Excess Vada Prakopam leads to excess Sankocham. If you try to cool something, if you try to freeze something, the structure, the molecules will become condensed with each other. As if like you are, what to say, keeping a cup of water inside the freezer. After some time, it will get freeze. The molecules will become very tight. In the same way, here also, the structure or the Srotas will become very tight. It will shrink. That is called Sroto Sankojam. That may leads to Shirashudam. Okay, in such cases, when they come to normal temperature, it will become normal.
Okay, sir. Thank you. Actually, I think Dr. Virendra Kumar Gupta raised his hand. Sir, you can unmute yourself and ask question. Dr. Virendra Kumar. Hello. I think he's not responding. Sir, one another question came in the chat box. What will be the logic for Beshaja Kala Muhur in Pitta Vigara with the Ahara?
So usually, as per the Muhur concept can be given only during the emergency condition. Most of the time, during the emergency condition, the Muhur has been given. And Muhur, as you told, nowadays it's quite common. People who are simply taking food for every half an hour or 1 hour in terms of chat foods or junk foods or whatever for every 1 hour. Those who are on vacation or leave, they will be keep on taking that. If that is the case, if they are keep on taking that, definitely one or other way the Jadragni Dushti is going to happen. No doubt about it, because the Agni Dushti will happen if they are continuously taking the food from morning till evening. That is considered as the Muhurmuhu. But the same Muhurmuhu can be apply it as medicine also in terms of Grahani. As we all the doctors knows very well, the Grahani is the disease that is IBS, irritable bowel syndrome. The Grahani or the Agni Ashayam is very weak. The patient, as soon as he takes the food, immediately he will have the tendency to pass the stools, because the Agni is very Balahinam or Vada Prakopam. In such cases, what will happen? We have to give the food little by little. Okay, if suppose the patient is taking, he can take 3 chapatis, he should not take at a stretch. He should take the first chapati at 9 o'clock, the second chapati around 9:45, and the third one at around 10:30. He should split it and have. That is the importance of Beshajam. So we can use it in both the ways. We can use it in both the ways, but both in treatment aspect as well as in pathology also. Pathology, if they are taking food continuously, intermittently, that is going to create the Amadosham. In turn, it will create the Pitta Dushti. Thank you.
Thank you so much, sir. I think no other questions are there. If anyone have any more doubts, you can ask. Okay, I think no other questions are there. Okay, sir, then we'll go to the concluding session. We'll go to vote of thanks. Myself, Dr. Shinaz, BS Assistant Professor, Department of Panchakarma, as organizing committee member of Prabodhini webinar series. So now we reached to the 26th Parva of Prabodhini webinar series. Actually, continuously we are conducting 26 months continuously. So last time we conducted 25th episode. So this is because of the more that effectiveness in the community, especially in the Ayurvedic scenario. We have to think that to spread the knowledge maximum. For that purpose, we started this Prabodhini webinar series, and it is going in a good way. Like that, our Sakthi Kumar sir today explained very detailedly about the logics, how to act, how to behave, how to take the classical thing to the practical aspect. So thing is that what written in the textbook and how we are practicing is entirely different, because one line is quoted actually that the logics, how to, one question also came that how to become that logic thing. So what is written in the textbook, that is letters only, lines only. Last time I think Govuma sir also told us, and Tadaksharam Adhigamede, we have to go beyond the lines, not read the lines, also you have to read, and below behind the line also we have to read that, then only you have to get the logic and all. So that's why we will go to the detailed things nowadays. Okay, so then we'll go to the vote of thanks. I would like to thank our respected chairman, Sir Dr. Shailendra Yadav sir. So he's the, and also our chairperson, Dr. Sunita Yadav ma'am. These people are given much more strength and support for this Prabodhini platform for all the purpose. So they are giving much more motivation and all. So that's why we are conducting continuously this Prabodhini series. Also that again, I would like to thank our respected principal, Sir Dr. Manjunatha NS. He's more inspirational and giving much more support to this Prabodhini webinar series. Thank you so much, sir. And I would like to thank our respected Dr. T. Sakthi Kumar, sir, today's speaker. So, sir, given a wonderful speech today. Actually, is a different type of speech. Normally, we are giving the presentation and circa. Actually, the presentation style also somewhat different. But given some interesting way, sir concluded or sir conveyed more multiple factors in the clinical practice. For more in the from the first year student to as a physician, sir is given a good information from this presentation. Thank you so much, sir, for your great presentation and your valuable time. We heard from you from that you have more expert in Marma Chikitsa and Nadi Pariksha. I think already we requested, if time allows, means surely we will just give share our knowledge to other students, sir. Thank you so much, sir, for your valuable time. So now I will like to thank our Department of Brajana Sharira that they will conduct today's webinar. Dr. Sharangappan is our HOD and Professor of HOD Department of Rajana Sharira, and Dr. Gagan and Dr. Krishna Yadav. Thank you so much. And main important people in the organizers of this Prabodhini webinar series, Dr. Nihar Ranchan, Associate Professor, Department of Panchakarma, and Dr. Pridhimai Sahu, Associate Professor, Department of Kaya Chikitsa, SS University, and myself, Dr. Shinas, Department of Panchakarma. And also, I would like to thank all the faculty members in Sri Babu Singh Jai Singh Ayurveda Medical College for your great support and convenience, and also all the students and all the delegates from this program, because they are the main supportive things. Actually, the inspiration is come the response. After every webinar, that we will get a much more responses. Still, we are getting in the chat box more responses today's session. Thank you so much for all your participation, active participation. Thank you so much. So we will come with the new best topics and best speakers in the coming episode also. Please stay tuned with us. So one more note I am adding to here, actually from the chat box we got one message. Actually last that webinar, some people got some problem in the certificate. I think every time we will starting the webinar, we will give the some instruction how to register and all these things. So your name you have to be given in correct because your full name have to be given in the that registration time. So that same name only come in the certificate. So last time what happened, some people phone names are Gambivo, their hospital name, like that some issues came in last time. So because of that or some verification needed in that, so you have to let just mail us, we will verify it and surely we'll let you know that thing. So thank you so much, or we'll conclude this section with the national anthem. One more thing, actually within 7 days you will get the working days, you will get the certificate, and video recordings also will share to the WhatsApp group. Thank you one and all.